I am married to Charlene Hafer Macko, and I'd like to thank her and Kathy Brown for inviting me to talk, and also to say that most of the materials you're going to be hearing about today are from the Health and Human Services 2018 Presidential Advisory Group panel that was tasked, and there were 17 of us, to evaluate physical activity guidelines for all Americans. And this took place between 2016 and 2018, and it did not have material on myasthenia gravis in it, because the question is this a neuromuscular disorder? What does this have to do with the brain? So you're asking yourself this question: does myasthenia gravis affect the brain? So let me throw out a couple of descriptive words. I don't want to spend too much time on this because really there is extremely little known about brain health and myasthenia gravis. But let me ask you this question. Do you all feel that you have a reduced attention? That you're more distractible? That you have difficulty with multitasking? And that if you're doing something called trying to put task sequences together, like what's called working memory, that it's very difficult to do that? Is that the description? Okay, is that the best description that you have? What do you call that? In the field of neuropsychology and cognitive neuroscience, they call that executive function. And I'm not going to spend a lot of time on this, but my hypothesis is, and I think many of you experienced, that impairments of executive function are the Achilles heel of the central nervous system. They're the last to develop. It has to do with myelination of the central nervous system from a caudal to rostral. The brainstem matures first, the white matter matures second. Executive function matures in humans by the age of 25 years. And it's multiple networks in the nervous system are put together. And it includes attention, concentration, speed of motor processing, task sequencing, distractibility, or the ability to suppress unwanted stimuli, working memory. These are some of what we call the key components. And it is the first one to go in people with brain injury, traumatic brain injury, stroke, diabetes, advancing age. It is the 800-pound gorilla of cognitive impairment. And short-term memory is included amongst that. So let's think that we may have our hands on a phenomena here, but go on for a second and say, John Kesey trained me at UCLA, and I think Charlene Hafer Macko, she's kibbutzing against the back wall. I got her attention. So John Kesey was one of the UCLA neurologists that helped train us. And back in 1999, he asked the question, does myasthenia gravis affect the brain? And you have to think about the nicotinic acetylcholinergic receptors and the antibodies to those, which we see in myasthenia gravis. There are really not very many of them in the central nervous system. And people didn't document specific cognitive problems. Sure, they found a slight increase in epilepsy, a couple of things that may be related to hypoxia, ischemia, brain damage that might have come from the pulmonary problems. And John Kesey very astutely said, maybe the respiratory problems in providing oxygen at night, because this is before the sleep apnea epidemic got recognized. He started to think, he's a very, very smart, astute clinician, that may be affecting cognitive function. And absolutely, that story is unraveled, quite very much so. But the conclusions are this. Considering the number and variety of claims for direct CNS involvement in myasthenia gravis, the evidence for this is remarkably unconvincing. Not convincing. Go do a PubMed search and hunt up how much of a problem there might be in the brain in people with myasthenia gravis. And I'm going to tell you what, if the problem's in the muscle, and MG is primarily a condition that affects the neuromuscular junction. We all know that if there's immune-mediated, complement-mediated attack at the neuromuscular junction, the main effects are muscular weakness. Then why is brain health important? Why am I here talking about brain health and trying to convince you with not a lot of data? So, we're going to ask ourselves, what factors are the most important factors in affecting brain health? What do you all need to know about that are factors that affect your brain health and what are modifiable? Why might this be more important for persons with myasthenia gravis? Why could there be an increased susceptibility to cognitive declines that are periodic and to cognitive declines in advancing age that may lead up to problems? So, during this presentation, I like to focus on questions, and I love when people throw questions from the audience at me. You recall Vegas? I had a question and answer session, and if you stumped me, I had to sing an Elvis song or dance, and I elected to sing an Elvis song. So if you stump me tonight on a question, and I'm going to go through these 5, I'll sing a song from The Wizard of Oz. But just a phrase or 2 from it, okay? So you all keep that in mind as a sort of incentive. What is brain health? What factors are linked to worsening of brain health? What are the factors that are known to be linked to worsening brain health? And what are proven to be modifiable, and what's the proof? And how powerful is that proof? So we're not speaking out of conjecture, we're going to talk about evidence-based, right? Why might brain health be especially important for individuals with MG? What's the evidence? And here I'm going to go to the Health and Human Service 2018 guidelines, which are, if you look up 2018 HHS physical activity guidelines on Google right now, you'll find those are released by the Honorable Secretary Alex Azar on March 2nd for a 30-day period of public examination, the effects of physical activity on brain health. You can find all of it there. Don't let the fact that it's an 800-page book scare you. It scares the daylights out of me. But just focus on the brain health part, and that's what I've abstracted to tell you about today. And finally, what can you do about it? What might you be able to do about it? Because brain health is something it's important for public health, but it's also important to every one of us and our lives. And how we live our lives may affect that. So I'm going to just tell you that brain health is age dependent, and we can't really look at one particular age and say this is what brain health is. Point in fact, individuals that are 65 years of age or older have one cognitive domain or more that is abnormal greater than 1 to 1.5 standard deviations. And that meets the Diagnostic and Statistics Manual 5, the 2014 criteria for mild cognitive impairment. And they're starting to pay attention to those because that increases your risk for dementia, and that absolutely occurs with aging. 20 to 30% of people develop dementia when they're in their 80s, and part of that is the exponential increase that occurs in plaque, amyloid plaque, interacting with other factors that hurt the brain in aging. Cognitive function. And I think we include memory, executive function, attention, concentration, semantic memory, which may be famous faces, recollections, working memory, which involves how many facts on the left side of the brain, which is lexical, it's word processing, you can juggle at one time, how many on the right brain, which is visuospatial, you can juggle at one time. Sleep and circadian rhythms are definitely controlled by your brain. And if your brain is unhealthy, you start to develop dementia, you will fragment your sleep, and that'll screw up your cognitive function during the day. And slow wave sleep is the phase in which the brain has regenerative functions. And so sleep and circadian rhythms, every single cell in your body has circadian rhythms all the way down to the genetics. Your brain is very circadian driven. Mood. I'm not going to spend as much time. Suzanne Ruff's going to spend more time on this. But if you want to have a healthy brain, you got to be happy. I mean, if you're not happy, you don't have a very good brain. You're miserable. And inflammation is associated with depression, anxiety, another symptom. Those are both more common in people with myasthenia gravis, as they are in other intermittent conditions that affect the nervous system. So I'm going to say that cognitive function, sleep, circadian rhythms, mood, and you were starting to get at a couple of other points. Structural integrity of the brain, such as diffusion tensor imaging, volumetrics of the brain, which are known to get worse with advancing age and with the presence of risk factors. Brain blood flow. Okay, I'm a cerebrovascular neurologist. I study stroke, exercise, brain rehabilitation. you definitely show impairments in the ability of blood vessels to dilate and supply blood to the brain and match to metabolic needs with advancing age. And that absolutely is linked into impaired cognitive function. You want to know what the nickname for Alzheimer's disease is? Diabetes type 3. Has anybody heard of that before? It's like the battery turning off in the brain because the receptors for glucose downregulate with inflammation and with the pathology of Alzheimer's disease. It's like the lights go off because there's no battery. So it's not just neurofibrillary plaques and tangles. So biomarkers of brain health, which I think many of you know about brain-derived neurotrophic factor imaging and other things. I'm going to focus on these two: cognitive function, sleep, and circadian rhythm. So, okay, this is a slide that it's a little bit risky. I've put together all of the things I know and have learned about brain health that I could fit on one slide. In other words, all of my neurological knowledge you could fit in the size of a walnut, perhaps, if you were maybe a large walnut. But so, factors that influence cognitive decline and dementia. This means mild cognitive impairment, which is a category many of you may not have heard about. Dementia. What is linked to it? Is genetics linked to it? Absolutely. Many of you have heard of ApoE4. That is associated with maybe a 2 to 3-fold increased risk of dementia. That's seen in Hardy-Weinberg equilibrium, which means 25% of the population. People can send in their blood and get checked on that to find out if you have some increased risk. There are variants of brain-derived neurotrophic factors and other factors which are linked to cognitive function as well. What are you going to do about that? Change your genes? Well, if they're dirty, what can you do? You're not going to be able to do anything much about that. What you are going to do is recognize that this is part of a syndrome. You have to understand the genetics of cognitive decline in order to understand the syndrome, to know what works and what doesn't in different populations. And that's where the field is going right now. Vascular risk factors. Yes. So vascular disease risk factors are associated with an increased risk. And the length and the severity that anybody's had, hypertension, diabetes, obesity, insulin resistance, all of those factors are associated with more hits on the brain, and you can see that with magnetic resonance imaging, volumetrics, and structural integrity studies, and you can see it on cognitive testing. You can plot the yearly decline by diffusion tensor imaging and the integrity of the subcortical white matter of the brain in many populations year by year and see the cognitive declines go down. What happens when you aggressively intervene? If I took a group of people, aggressively intervened, you create a 10 or a 12% reduction in the risk factor for actually developing dementia. That appears to be a ballpark figure of what it is based on randomized controlled trials where they really did aggressive vascular risk factor management. Sleep problems, absolutely. Increasing knowledge that sleep problems, especially apnea, obstructive sleep apnea, predicts increased Alzheimer's amyloid plaques in your brain and an increased risk for cognitive decline and dementia. If you have cognitive decline and you have snoring at night, it's one of the 4 criteria for obstructive sleep apnea. It is a criteria for obstructive sleep apnea. A study I've seen so far that has looked at Myasthenia gravis populations has found increased incidence of sleep apnea and obstructive sleep apnea generally in those populations. And I can also tell you that obesity predicts a 2 to 10-fold increased risk in the development of obstructive sleep apnea. And I can tell you that people in their middle adult, not older adult years, it's closer to 10-fold because that becomes the isolated risk factor that increases the risk for sleep apnea. So obesity drives it up, and whether or not it's also increased by myasthenia gravis, it probably looks that way. What do I think? I think your doctors are doing the right thing. They're realizing there's 2 factors that interact with each other, and they're monitoring them, and they should. because obstructive sleep apnea is now considered by the Centers of Disease Control an epidemic. Used to be thought it was 17%. Now it's considered to be 27% of the adult population between 17 and 70. You can find that on cdc.gov. If you read about sleep health, you'll find out that that is one of the biggest problems right now that we're trying to figure out how to deal with the volumes of people, because they cannot do enough polysomnograms. They can't even diagnose the number of people that have the problem, and it is really very bad for the heart, the brain, diabetes, refractory hypertension, and cognitive decline. And the people in Alzheimer's are looking at it very carefully. So you want to do the best you can with that. I think your doctors are doing the right thing, and there are relationships. Part of the reason why people with MG need to be watching. Well, you know, antioxidants. Everybody's thinking about oxidative injury. That drives cellular senescence. It's what is thought to make neurodegeneration in the nervous system occur that leads to dementia. Absolutely, inflammation is a common link between stroke and Alzheimer's disease and the development of dementia. Anti-inflammatories, non-steroidals, ineffective in the treatment. There are some curcumin and some other kind of new wave antioxidants that are nutritionally derived that are of great interest in protecting the brain. There's some evidence from the vitamin E studies that were done inside of the VA that there may be some benefit to motor function, but they don't have this down yet. So, yeah, it does something, but they don't know how much. And fish oils, omega-3s, okay? Omega-3s are in competition with omega-6s. Omega-6s are bad. They increase oxidative injury. Omega-3s are good. They reduce oxidative injury in the brain. They're part of the cellular constituents of the membrane of every cell in the nervous system, and they regulate the genetics of it. If you are having a Western diet and you're not taking in icosapentaenoic acid and docosahexaenoic acid, which go right into the nervous system, and your levels are around 15 to 1 for those ratios. It's very bad for the brain. So I give my people with advancing age and geriatric neurology, with any neurological condition, I either check those levels or I give them fish oils, and it's cheap enough and easy enough to do that. In terms of nutritional supplements, you're going into unknown territory, and I don't like to speak without an evidence base. But what I can tell you is that meta-analysis of all of the studies that looked at relationships between fish oil levels in the bloodstream and cognitive function and aging and dementia and in development in children, because it's a universal thing across the lifespan, tell you that the fish oils may be helpful, but they don't have randomized studies. The other thing is the vitamin E may be helpful as well. And you all know that vitamin D is a very good thing to take because it affects insulin sensitivity, affects the health of your muscles. And that's a good thing. But beyond that, no. There is not any clear evidence yet. Is associated with a 38 to 42% reduction in the chances of developing dementia. There is nothing as powerful as that that's been recorded for the prevention of developing dementia and cognitive decline. There are no medications that change the natural history of progression, only symptomatic. And brain games, it's not proven that they generalize to help cognitive function. They help those things upon which you train. So, the most powerful modifiable factor known to influence brain health is physical activity, and myasthenia gravis can reduce that. MG can reduce the capacity for regular physical activity. Low activity predisposes to vascular risk, which increases the chances of getting cognitive decline and dementia. Some meds, the steroids, can increase cardiovascular risk factors, and sleep apnea, as we've discussed before, is a problem. So for these reasons, to begin with, I would say that we have to be concerned with other systems besides the muscle for whole health. Muscle is an endocrine tissue. Don't let anybody tell you that the brain and the muscle are separate. The muscle makes and releases neurogenic myokines. That means factors that come out of the muscle that float around in the bloodstream and go into the brain that turn on neuroplasticity. One of those that's most known is brain-derived neurotrophic factors. So You see exercise increases BDNF in the muscle and the brain, which stimulates brain plasticity. It increases hippocampal size, and that improves memory. Those are known. PNAS 2012, Kirk Erickson, he was the head of our brain subcommittee for Health and Human Services. That's one of the studies that he's done. So let's get to this meat and potatoes of the talk. The Physical Activity Guidelines Advisory Committee, again, Kirk Erickson was the head. I was one of 5 people that were on the Brain Health Committee. And we looked at what's the relationship between physical activity and cognition. We had $2 million. It took us 2 years. We had about 40 staff members, the Centers for Disease Control, Health and Human Services, Office of Disease Prevention and Health Promotion. It was a lot of work. It's mostly what I've done in the past 2 years. For the Brain Health Committee, for this question, we looked at 32 meta-analysis and scientific reviews. That means it's not an individual study. It means 350 studies, more than, and more than 40,000 people. So this is a huge body of knowledge. And this is the first time that I'm aware of in history that a government has released specific recommendations on brain health from this systematic review of the world's vetted literature. This is what we find. Let's get down to the meat and potatoes. Consistent association between greater amounts of physical activity and improvement in cognition, including performance on academic achievement tests in children, performance on neuropsychological tests, including processing speed, memory, executive function, in adults, primarily older than 50 years of age, and a reduced risk of dementia, which is 38 to 40%, which is huge. It's 3 or 4 times bigger than anything we know in terms of preventing and helping the brain in health. Such evidence has been demonstrated across numerous populations and individuals representing a gradient of normal to impaired cognitive health. We were sort of blown away by the consistency of this finding all across schizophrenia, stroke populations, Parkinson's disease, so many different populations all showed a consistency. Kids, older adults. So let's stop and take a minute and say, what are the characteristics of the effects of physical activity? And this is something that's a bit of an eye-opener. We all think regular training. No. A single bout of physical activity, an acute bout, 11 to 20 minutes long, in fact, is optimal, improves your cognitive function right now. And it lasts for an optimal time of 20 to 45 minutes. It's enough to move a kid on a spelling test from a B to an A. And that's the effect size. This is being used in school systems that are progressive. There's an immediate effect, and then there's a more robust effect if you do regular physical activity, so it builds up. Domains, attention, memory, crystallized intelligence, that's your kind of general fund of knowledge, like who's the president? Is there anybody here that does not know who the president is? Is there anybody here that, I'll just shut up and I won't talk about it anymore. Yes, but this is part of crystallized knowledge. Physical activity modalities, a variety of forms, including aerobic activity. Brisk walking, just walking, is enough to turn on your metabolic system. And that is what you need to do on a regular basis. Muscle strengthening, yoga, and play activities, tag, or other simple games. So this, I spent a tremendous amount of time constructing this table because I wanted to get an idea of what's called the magnitude of effect, or the effect size. And when you have a meta-analysis, you can put all these studies together and calculate the average effect that it has on brain functions or whatever outcome you're looking at. And I'm going to start here and say that normal cognitive function goes 1 to 1.5 standard deviations away from the norm. Okay, so this is normal. You go that way, you're going in the wrong direction. You go this way, you're going into higher cognitive function. Okay? So if you have 1 to 1.5 negative, you have mild cognitive impairment. When you start to get into the zone, usually you have multiple domains that are impaired, and it affects your daily function, and that's called dementia, right? If you have dementia, you have increased 0.42 in this direction. You increase 0.42 points in terms of the statistical benefit in the correct direction with cognitive function. If you are doing regular physical activity in adults and children, 5 to 13, and the other ages they just don't have enough information on yet because it's too new and young of a field, You increase 0.1 to 0.67, and it's usually about 0.3 to 0.67. That's the average figure. So you can move yourself from here to here, from mildly impaired into the normal range with regular exercise. And in those people that do a single bout of physical activity, a short-term effect moves you that should be 0.14 to 0.67, but it's mostly 0.1 to 0.3. It's smaller, so I made this area smaller here. This arrow's smaller, but kids are going to do better on their spelling tests. They will go from a B to an A. That's an example of what Chuck Hillman, who's the pediatric researcher that did the cognitive testing, said. So this gives you some sort of an idea that these effect sizes of physical activity are consequential to your brain health and function. This is not just some game of statistics. This is real, and it's substantive. Strong evidence indicates greater amounts of physical activity are associated with reduced risk of developing dementia. What's the evidence? 15 studies, 1 to 12 years duration, tracking people that long forward. 33,000 people, 38% reduced risk of cognitive decline. 10 studies, 20,000 people, 40% reduced risk of developing Alzheimer's disease and Alzheimer's disease-related disorders. Now let's put a little bit more icing on the cake. What happens if you already have dementia? If you have early stages of dementia, you have cognitive impairment? 18 randomized clinical trials with a treatment and a control group blinded. Well done. 802 people with dementia. Physical activity improves cognitive function with an overall effect size of 0.42. So it moves you almost a half standard deviation back to square. That is much more powerful than the medicines that we use as neurologists. And this is basically generalized cognitive function, not just one specific thing. It's many, many domains. Significance. 21% of the cases of Alzheimer's disease, it's now believed in the United States, are attributable to physical inactivity at great cost, and increasing physical activity is the most proven and robust way to improve cognitive function and reduce risk for dementia. Now, I think we need to find those kinds of things out in Myasthenia gravis, which is going to have a more susceptible population. Now, how many people have problems sleeping? Some sort of sleep disorder? Yeah, okay. I'll raise my hand and join you on that. 30% of US adults, 10% that meet the clinical diagnosis, about 30 to 50% that have symptoms of it, and 27% of the US adult population with sleep apnea. What's the relationship between physical activity and sleep? And so we looked at 66 intervention studies that included 2,800 adults that were those ages. These were randomized controlled studies. These are very well done studies in exercise science, not prospective epidemiologics. We had 89% without and 11% with sleep problems, all different types of exercise, and the exercise was in general well characterized. And I'm going to unfortunately slide through this slide quickly. It's a complicated one. But what you're seeing is regular physical activity and acute bouts of physical activity have an effect on improving total sleep time. They improve sleep efficiency, which is the amount of time you're sleeping given the block of time you have to sleep. They improve sleep onset latency. Those of you who have problems falling to sleep at night, that's part of the signs of insomnia. It improves sleep onset latency and sleep quality. Slow wave sleep, acute bouts of physical activity improve that. That's associated with memory consolidation, and that's the healing time for the brain. And it reduces rapid eye movement sleep, which is you get too much of that, it's not as good for you. So every one of these is positive. So we are going to say that the government, HHS, has released a statement, you can find it on the website, that there is an association between greater amounts of both acute bouts of physical activity, the number of minutes of acute bouts of physical activity, regardless of its intensity or what type, it's the number of minutes, is associated with all these improvements in sleep outcomes. And you can do it like right now and have an effect later that night. And the regular activity makes it better. How about insomniacs? The evidence comes from 18 to 100-year-old people, 6 cross-sectional studies, 660 people with 4 randomized controlled trials in middle-aged women, and middle-aged and older adults with sleep problems. And I'm not going to spend a lot of time going over definitions here, so let's just go on. The Pittsburgh Sleep Quality Index is the most well-known index in the United States to look at quality of sleep, and it gives you a global score on 7 components of sleep, and it is improved in individuals that have gone through physical activity as an intervention. There's a reduced sleep latency subscale, so you fall asleep quicker. Reduced medication used to go to sleep. And these effect sizes are moderate, but they're pretty pervasive. Let's go on. Sleep apnea. This is really a public health scourge right now. Well, what we did is looked at 6 studies, 3 randomized clinical trials with 182 subjects, and another 80 randomized trials with 4,300 people that included people, 72 that were in physical activity treatment arms versus other conventional therapies. What did we find? Reduced apnea-hypopnea index, 6.3 less breath-holding spells in every one of the minutes. That's basically can take you from mild to normal or from moderate to mild. And I'm sorry, that's the change in events per hours. And this is independent of weight loss, and it's roughly equivalent to the CPAP. So you will see an effect of reduced apnea events with physical activity. And we are using that as something that we think is more of a public health measure, increasing physical activity. It's the most proven way to improve brain health, prevent dementia, improves cognitive function in those already with cognitive impairments and early dementia, reduces and prevents depression and anxiety as effectively as antidepressants. And I didn't have a chance to go through that data. You can find it on the web. Improves sleep health. That includes insomnia, obstructive sleep apnea, and it has benefits for vascular disease prevention. So how much is needed? It's my last slide. Health and Human Services suggests 150 minutes a week of moderate to vigorous, but they realize that not everybody can do that, and small amounts add up. And so there's no evidence that you have to do it for 10 or 20 minutes in a row. The total cumulative steps a day now count. We also know that walking meets the definition. You don't have to run. You want to just get metabolic activity up. And we've also published that there's an interaction with sedentary behavior in such that if you're sedentary for 7 hours or so through the day, which is part of the definition, you'll have to do a whole hell of a lot more exercise to reverse that. And that you should be getting up and doing a couple of minutes of walking every 20 to 30 minutes, because you will basically triple or quadruple the amount of exercise you need to do to reverse sitting. That may be one of the most important things that we can do, is recognize the interaction between sedentary behavior and the amount of physical activity. 2 minutes of walking improves your insulin sensitivity and glucose tolerance in people that have pre-diabetic state robustly. So they're looking at the smallest amounts you can do to help yourselves. Do not overdo it. Rest is when healthy adaptations occur, and I'm done.